In today's video, let's talk about the connection between our hormones and anxiety. So let's dive in. One of the major hormones I talk about quite a bit on this channel is cortisol. Now, it will probably come as no surprise that chronically elevated levels of cortisol can lead to mood changes and new or worsening onset of things like anxiety. We know from research that when we have chronically increased levels of cortisol, so coming from chronic stress, that long-term stress that a lot of us are dealing with, we know that when we have this, it can actually start to disrupt certain areas of the brain, especially the limbic system. Now, this is generally the area that has a lot to do with fear, our memory, and kind of learning and consolidation. When we have that kind of chronic increase in cortisol, we have changes in this area of the brain. Those changes can lead to increasing types of anxiety. And we also see this same thing happen in other types of mental disorders, such as PTSD. We see this change in the amygdala, and we know that one of the things that can cause this to change is the stress hormone cortisol. So doing everything we can around reducing those levels of cortisol. So doing all the techniques that you have to help reduce chronic stress. So that goes from, things like meditation and mindfulness, journaling, to also adjunctive care, maybe herbs or supplements, or even medications, or even things like therapy and different methods as that. And of course, things like nutrition and exercise are also going to be important here as well. I have an entire playlist about how to deal with cortisol, how to deal with chronic stress. So if you check those out, I think you'll find a lot of resources there. Now, another important thing that I see quite often with hormones having an impact of anxiety has to do with women going through perimenopause and menopause. There are huge shifts that are happening with estrogen, progesterone, and even testosterone. And a lot of our hormones are fluctuating. Now, these changes, especially in estrogen and progesterone, can have a huge impact on anxiety and mood and even depression in many cases. We are getting a drop in estrogen. Often our progesterone is fluctuating. And we think a lot of times as progesterone as more of a calming hormone, helps to kind of regulate our mood. And estrogen plays a role in this as well. So when that period of transition happens from perimenopause through menopause, and then even after menopause, there is a lot of new onset anxiety that I see, or worsening of anxiety symptoms. So in this case, again, there are many different ways to approach this. It's just going to depend on you as a patient, what you're comfortable with. Of course, there is hormone replacement therapy. I even with patients will start women during perimenopause on things like progesterone, or sometimes even a little bit of estrogen. And there are many different routes to do that as well. So that, of course, is always one option. And there are also a number of different herbs and supplements. Some, phytoestrogens or other herbs and supplements that can actually kind of fit into estrogen receptors. It's, again, really going to be dependent on what you need. I would also say, let's not forget about men, because men have hormonal changes as well. Yeah, we don't exactly have the equivalent of menopause, but we often see levels of testosterone drop in men, in middle to late age as well. And we know that testosterone is actually helpful for men in decreasing anxiety. So for a lot of men, when we see that testosterone levels start to drop, they often also experience new onset or worsening anxiety as well. So it's not just women who experience these hormonal changes and have changes to their mood or anxiety. Of course, there are things like acupuncture can help. I've seen this help tremendously with anxiety. And all this comes along with saying, of course, having, that community or social support is also something that can be very helpful. My approach to working with anxiety and hormones is all about bringing all the pieces to the table. So looking at your exercise, looking at your nutrition, looking at your gut health is another really important factor. There are a number of hormones and neurotransmitters that are also produced in the gut as well. So looking at gut health is usually really crucial, because a lot of times if I'm giving a supplement or an herb or even a medication at times, if the gut health and the gut is not working well, if there's a lot of leaky gut, or if you're not absorbing things well, or if your liver is not detoxifying very well, if your pathways are a little bit plugged up, a lot of times that supplement does not have maximum effect until we actually balance out the gut. And there have been a number of times for me in practice where I think I'm going to have to go in and kind of regulate hormones. But if we balance the gut first, the hormones, for whatever reason, actually start to balance out on their own. So making a deeper dive into gut health, for me, goes along with hormonal health as well. And again, all of this can affect your mood, especially anxiety. Making sure that you're touching all these areas or investigating all these areas, especially if, you've reached out to your doctor and maybe there isn't a lot of support that they've been able to offer. Maybe they can only offer medication and maybe you're interested in something else. This is something that I would definitely recommend you speak with a practitioner about. Again, always want to empower you about your options, taking control of your health. Of course, I always want you to be working with your practitioner. Let's not throw our practitioners out, but sometimes we need to ask these questions, and I want this information available to you. I hope that this was helpful and that you've learned something. As always, if you would like to learn how to work with me, you can look down in the description box. I will pin a comment as well for ways to work with me. If you have any questions, leave them down below in the comments as well. Otherwise, I will see you in the next video. Bye.